According to Statistics Canada, the number of senior citizens is expected to double over the next 25 years. The reason is because baby boomers will begin turning 65. In fact, some project that senior citizens will outnumber children in the country by the year 2036. And that has some people worried about an aging population putting too much strain on Canada's healthcare system. So, are the fears warranted? We're continuing our series on baby boomers this morning with Susan Ing. She's with CARP, the Canadian Association for Retired Persons, and she's here in our studio. We've been hearing this for a while, this coming population boom when everybody kind of needs maybe more health care, maybe all of this, and can the healthcare system sustain it? But let's break it down in terms of what is reality from fiction. What will this population need?
Well, you know, I think the important question that people are always asking, they're saying, well, what's going to be the impact of boomers on the health budget and so on? And what they mean by that, of course, is negative. They're saying they're going to cost us all this money.
Right.
But I think the thing to remember now is that this large demographic is also very actively engaged. It's living longer, healthier, and they have certain expectations about what the public healthcare system should do for them. They are a very demanding group, and they know how to get their demands met with the political system. So now the answer to the question, the right answer to the question is whatever their values are, their expectations, and they're not going to take no for an answer, that's what's going to determine what's going to happen with their health budgets.
Well, there's been a lot of discussion surrounding pension and pension reform and what should happen to CPP so that it's mitigated, so that there isn't a big strain. What kinds of reforms would be needed from the current system now?
Well, there are a number of things. And I think that we have to, first of all, look at the fact that we're dealing with a population that does not see itself as old. It sees itself as still young and expecting the system to focus on the issues that matter. So, yes, there will be people who are going to be concerned with their security in retirement. That's why we don't use the full name anymore, because most of our people are not retiring.
Right.
You know, so we have people who are reaching a certain age, you know, that societal construct of when you're supposed to retire, but they're not retiring. And they don't like being classed as somehow no longer contributing to society. I mean, even some of the stock footage that that media shows all the time tends to look at people sort of
stereotypical.
Yes, self-consciously trying to be younger than they are. Well, that's not our demographic anymore. It's a group of people who's proud of who and what they have achieved in life, and they've paid their taxes all these many years.
Many will stay working.
And they will keep working and contributing. And so they don't like stereotypes or presumptions that suggest that they are no longer contributors and now takers from the system. So that's an important change in the dynamic. And this is the group, as I said earlier, that is willing to vote in order to make sure that its concerns are responded.
Well, they've got the power because they've got the numbers, right?
Well, and they use it. You know, there are lots of numbers in Canada, but of the eligible voters, it's only those people who are over 60 who tend to vote all the time. In fact, 70% of that demographic votes regularly. Wow. So that's the group you should be listening to.
Okay, Susan Ing, thank you so much for coming in to discuss this with us.